Hello, welcome to a discussion about psychological disorders. A lot of people really like learning about disorders, and in the next few videos, we're going to talk about not only different disorders, but like today, right now, I'm going to talk about what disorders are. What does it mean to have a disorder? So, a lot of us have quirks, issues, and such. But does that mean we have a disorder? Psychological disorders are marked by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. What does it mean? It means that there is some evidence of a disturbed or dysfunctional thoughts, emotions, or behaviors, and that those interfere with normal functioning. A lot of people say, oh, I'm OCD, right? Well, I have obsessive compulsive disorder. Well, just because you check the locks once in a while, or you have to wash your hands 3 times a certain way, doesn't necessarily mean you have a disorder. Yes, there are some obsessive compulsive behaviors, but a disorder is when it interrupts your daily life and causes you emotional upset. Now, in the past, therapy was very different than therapy is now. Now, we don't drill heads or holes in heads anymore. We do still have psychosurgery, but they're very, very rare and a last resort. This here, the drilling holes in the head, it's called trepanation or trepanning, and it was to let out the evil spirits. And if you think about it, some disorders like schizophrenia could very well look like someone is possessed to somebody a couple thousand years ago who didn't know better. There have been evidence of drilling holes in heads back thousands of years. Now, the question is did this person survive? Well, if you look right here at the edge of this hole, it's kind of rounded, isn't it? Well, what that tells us is, yes, this person survived the first drilling of the hole in their head. And if you look here, they survived this one as well. Can you tell which one was first, this one or this one? Well, you probably can by the smoothness of the edge. This one here lower is smoother, and so probably the first one. This was the second one. So, yes, trepanation, trepanning, did happen. It's an interesting cocktail party word. I want to write that one down and remember that one. Not everybody knows what that means. And we don't drill holes in heads anymore. Back in the 1800s, there was a search for a physical cause for mental disorders. And mental illnesses were diagnosed by sets of symptoms, and they were treated through therapy, and people were treated much more humanely throughout the last 100 years. The way that we look at disorders now, so we look at the biological influences, evolution, genetics, brain chemistry, right? So a lot of you understand that brain chemistry imbalances can lead to depression. Okay, so we understand the biology behind this. We also understand that stress, trauma, learned helplessness, those all can also lead to psychological disorders, or is at least a piece of it. And your cultural roles, what is normal, what is a disorder, right? We talk about normality. I'll say this, normal is a setting on your dryer. There really is no such thing as normal. How many of you felt normal in high school? Maybe a couple of you, but the majority didn't. This idea of normal. Now, I like to use the word neurotypical and aneurotypical. So neurotypical is somebody who has a typically wired brain. Aneurotypical means someone whose brain is not typically wired. And typical is more related to the general population, most people. I think that we really need to shift our idea of what a disorder is and what normality is, because really none of us are normal. We are all individuals, and we all have slightly different brain wirings. However, a lot of us have some similarities, some differences. So understanding that. So now, the way that biology and psychology and culture all come together, this is going to help decide whether something is a disorder or not. I want to go back. For example, when it comes to social and cultural, keep in mind, in our country, in the United States, going topless on a beach is deviant, right? It's against the rules. You're not supposed to do that. You could be arrested and fined. In France, going topless on the beach is acceptable. It is how most people behave. And so it's not deviant. So you've got to take into consideration the culture and the climate that you're in on whether or not that behavior is deviant or abnormal. In the United States, people pierce their babies' ears. In other countries, they see that as being barbaric. So when you're judging another country, first of all, don't judge. Second of all, definitely don't compare another country to your country and your country's behaviors and standards, because they are very different. And this is what makes deciding if a behavior is a disorder more interesting and difficult, because you have to take into the cultural influences. You can't just go based by a list of behaviors, because that wouldn't work. So it is very subjective, and it's subjective to the individual. My level of anxiety may be uncomfortable to some, and it may be comfortable to others. So I can't say that my level of anxiety that I might experience would be equal to anyone else. And maybe my level of anxiety is okay for me. I don't feel that it's a disorder, but that same level could be very well perceived as a disorder to someone else because it's uncomfortable and it interrupts their life. So you can't take how you feel and apply that to other people. Well, I have anxiety, so, they should just suck it up. We can't do that. It is a very subjective thing. It is a very individual thing that goes between an individual and their doctor when determining if there's a disorder. So we use a diagnostic classification manual, the DSM-5. It's on the 5th version right now. And it helps to predict a disorder's future course. So let's say I am diagnosed with anxiety. What does that mean? It means that there's certain behaviors that I'm experiencing now. It means I know what treatments that we can focus on, and that I have a prognosis for the future. So that is why we use the DSM-5. It's to help people. The problem with helping people through a label is that a lot of labels can be misconstrued, or people can use them against you. So I'm hoping that all of you throughout this course, or this section especially, understand that labels are not beneficial to hurt people. They're there to help people. When we label someone, let's say someone has ADHD, the reason that we do so is so that we know, again, treatment, course of action, and future prognosis, and understand that certain situations may be more difficult for individuals than others. That is the reason why we want a label, but it is not to use it against that individual. It is not to explain away an individual's behaviors. It is not to demean an individual. In the DSM-5, so the DSM-5 came out in 2014, I do believe. We're probably set for a DSM-6 here sooner than later. But right now we have the DSM-5. There are some changes that happened from the 4 to the 5. Big changes. It was a huge controversy. At first, when the 5 came out, the American Medical Association said, we're not going to use it. Nope, we don't like it. But since they don't have anything else to replace it, they had to go back and use it. There are some label changes. So autism spectrum disorder has been changed a little. Intellectual disability. The DSM-4 allowed practitioners and doctors to diagnose children under the age of 18 with bipolar disorder, and that is not the case anymore. In order for a bipolar disorder diagnosis, the individual usually has to be above the age of 18, and now we have replaced that with conduct disorders. So it's a different list of disorders, so that's more individualized, because generally if a child is acting out, giving them a bipolar disorder doesn't help them very much. But if we can narrow down, do they have a disorder like intermittent explosive disorder or a conduct disorder? So specific disorders, we can go and we can treat those. So it's better for the child, it's better treatment options, it's better prognosis options. Disruptive mood dysregulation disorder, prolonged bereavement depression. So they've added a couple different categories for depression. Some are controversial. Again, not everything is perfect when these come out, so we need to check them out. Also, their hoarding disorder, binge eating disorder are new categories. I am going to guess that when the DSM-6 comes out, internet use disorder will be on that list. So we'll see. So criticisms, so antisocial personality disorder and generalized anxiety disorder, it's difficult to do studies on those. It's difficult to test those. So there's not a lot of data behind them. However, they kept them, and we'll see how they go in the future books. Antisocial personality disorder is also known as sociopaths, psychopath. So people who are labeled as a sociopath, what we're saying is they have antisocial personality disorder. The benefits, so yeah, some of the downfalls is that yes, people use these labels to judge others. The benefits is that it allows people with a disorder to get help. So if you have a set of behaviors and then it gets labeled as ADHD, well, we know how to treat ADHD. There's several ways of treating it. We know how to accommodate for it. And so the individuals can get some assistance. If you move and you have, let's say you have an ADHD diagnosis and you move, you have a new doctor, you can say, hey, I have ADHD, instead of having to go through all the testing again. So having that label helps. Now, just because someone has a disorder doesn't mean you need to label them. I was in a discussion with some moms, and one of the moms was talking about how they think that their child is on the spectrum, the autism spectrum disorder. However, they've found ways to deal with her, and they've adjusted, the school has adjusted some things for her, and she's thriving and doing really well, and they work with her, and everything's great. And so they've learned how to manage what she's going through to a point where she's really excelling in her life. They don't have a disorder label. They did not go to the doctor. They did not get tested. So one of the other moms says, well, you should get her tested. To which I ask, why? Why? If you know how to adjust the world around the child and how to help the child adjust to the world around them, and they're doing well in school and they're doing well at home, what's the point of getting a label? There is no point of getting a label. That label then could just be used against the child. Now, if the child is struggling and concessions at school aren't happening, or at home you don't know what to do, yes, get the child tested. Absolutely get the child tested. But do so because the testing will help the child, not just because now the child has a label. That's not the point of any of this. Whether someone is depressed or has anxiety or bipolar, the point isn't so that they can get the label, it's so that they can get the assistance that goes with the testing. So there's a lot of stuff in the media can be tried to be used against people with mental disorders. That people with mental disorders are dangerous. Well, I'll tell you what. About 25% of women in the last year to 5 years have been diagnosed with depression. Do you see a mass amount of women picking up guns and shooting up schools or killing other people? No. The answer is no, you don't. A lot of the individuals who are very violent and who have hurt many were never diagnosed with a disorder and might not even qualify for a disorder. So mental disorders seldom, rarely lead to violence. It doesn't go hand in hand. It doesn't correlate. Now, yes, some disorders can be violent. Paranoid schizophrenics can be violent. There's not a lot of them. Not nearly as many people that have been diagnosed with other disorders. So we need to let that go. We really need to let go of this idea that people with mental disorders are dangerous. Most people are nonviolent. Most people with disorders are nonviolent. And a lot of people that have disorders are more likely to be victims, not attackers. So, psychological rates vary depending on the time and the place of the survey. Here's the thing about rates. When you hear 25% of women have been diagnosed with a mental disorder, there's the key right there, diagnosed. So how many of you in the past, let's say, last year, 2 years ago, you got sick, you thought you had the flu, and you didn't go to the doctor, right? Why am I going to spend 80 some odd dollars to go to the doctor to have them tell me that I have the flu, there's nothing they can do for me, and to go home? I'm just going to stay home. I am not counted now in the flu rates for the end of the year. So when doctors submit how many cases of flu they saw, I won't be in there. Does that mean I didn't have the flu? No. Reported rates are just that, reported rates. Right now, we are in the middle of a pandemic. We see reported rates of new cases of COVID-19. Are those the only cases out there? No. There's plenty of people who have it who aren't getting tested. I know several people who are very sick and not getting tested. They'll get tested if they put them in the hospital. But because they're young, they're waiting on testing them because we just don't have enough tests. So testing and the collection of numbers is really important when we look at this. So right here, we have this graph right here. And the United States has the highest number. Does that mean that we have the highest number of people with disorders? Or does just that mean we have the highest number of people with disorders that go to the doctor to get diagnosed? Also, Nigeria, do they have no disorders? They probably have a lot of people with disorders, but they also have a lot of other issues. And so people don't go to the doctor necessarily to get tested if there's other things going on in their world. Also, poverty. Poverty is a huge risk factor for disorders. People in low socioeconomic status, so poverty, low education, living in poor housing, have very, I want to say they're blue collar jobs mostly. Okay, these people that are living in poverty are the ones that have the highest rate of psychological disorders. Stress, malnutrition, poor living conditions, toxic living conditions. So we want to battle mental disorders? Well, let's deal with poverty. Let's make sure that everyone can afford good food and a good place to live and get a better education, at least finish high school, and maybe we'll see the numbers drop considerably. So, of the past year, the number of people diagnosed with psychological disorders, so depressive disorders, bipolar disorders are close to 10%. Phobias and other situations, almost 9%. Social anxiety disorder, about 7%. Now, social anxiety disorder, this is when people are afraid to go out in public. Antisocial personality disorder does not mean afraid of people. It means people who engage in antisocial behaviors, stealing, lying, hurting others, that kind of thing. They actually thrive on people. Social anxiety disorder. So when you're like, oh, I'm antisocial, I don't like people. No, social anxiety disorder is the fear of being around people. ADHD, about 4% of the population last year. Post-traumatic stress disorder, about 3.5%. Generalized anxiety disorder, about 3%. Schizophrenia is about 1% of the population, and obsessive compulsive disorder is about 1%. So what increases vulnerability to mental disorders? Well, here's a nice list of risk factors. So when we look at risk factors, academic failure, birth complications, caring for those who are chronically ill, it's a stressor. Child abuse or neglect, stressor. Chronic insomnia, okay, chronic pain, stressor. Family disorganization or conflict. Low birth weight, low socioeconomic status, mental illness, neurochemical imbalances, parents with mental issues, family members with mental issues, increases the likelihood of developing a mental issue. Personal loss, poor work skills and habits, poor coping mechanisms, not being able to read or having a reading disability or a sensory disability, stressful life events, substance abuse, trauma experiences. Okay, all of these are risk factors. Protective factors, look at number 1, aerobic exercise. I'll tell you what, working out is one of the best ways to balance out hormones and neurotransmitters. It's also the most impossible thing to do if you're depressed. I get it. Depression, it's difficult to get up and go take a shower, let alone go walk around the block. But aerobic exercise is a huge factor in protecting yourself from mental illness. Community, having a community that's really supportive, living in a very supportive community, just knowing that you have a group around you who are there for you, huge protective factor. Economic independence, having a good job, having good parents who taught you good parenting skill, who had parenting skills, who taught you some good life lessons. Feeling like you're in control. I mean, you may not feel like you're in control at work, but maybe you have a hobby or you're captain of the softball team. That's mastery of control. Feelings of security. Go back to Maslow's hierarchy of needs. You know, are your security needs met? Are your safety needs met? High self-esteem. Again, Maslow's hierarchy of needs. Where are you? Have you worked on belonging and then are your self-esteem? Literacy, being able to read. Positive attachment and early bonding. Your first 5 years of life have a lot to do with the rest of it. So, did you have good parents who cared, who protected you as much as possible, who taught you good life lessons? Or were you in a very unstable or disruptive environment? Positive parent-child relationships, problem-solving skills. Where do you think you learn problem-solving skills from? Not only from school, but from your parents, from growing up, from interacting in your environment. Resilient coping with stress and adversity. Again, coping skills, problem-solving skills go hand in hand. Social and work skills. So all of these go hand in hand with a good education, being well-rounded, having a good English and math background, and social support from family and friends. Again, we go back to that support, that community support, social support, friend support. All of that has a big influence on our mental health and our good protective factors. So that's the intro to disorders. And I will get to the next video that talks about individual disorders.